Howard, how do you copy now?
A4FL and 9LA, heavy line clearing up there. Also, the advice there were several other stations that came on the air a little while ago and getting to stand by for the net.
Thank you. Starting the software seems to help, so I hope it holds. I see WW9F and PYTBBQ are with us here today. That's wonderful. Appreciate that. I'm going to go ahead and check them in on NetLogger. And hopefully I won't have too many technical problems on my end. 12 megabits per second internet suffers here in Hawthorne, unfortunately. I'm being QTH until we get Starlink service next year from Musk Company. Over.
Yeah, I think Chip and Mark are also out there. I believe those are the two that I heard as I was waiting up for the net. So, you've got internet bandwidth, I've got processor problems up with my shoulders at the moment.
Well, the higher level thinking above the shoulders seems to be working perfectly fine. Thank you for the links that you've sent by email. I appreciate it. AA4FL, taking early check-ins for the Medical Image Radio Council. TVNet, make your call.
This is KD2HZG checking into the net.
Well, thank you. Nice to have you with us, KD2HZG. Appreciate that. Hopefully we'll have a nice, interesting conversation today. And we'll be able to participate and be part of it. So, any other early check-ins for the Medical Image Radio Council? TVNet. Go ahead and make your call.
This is N5 RTF.
Well, Chip, good morning. N5 RTF. I've got you checked in. I also see on NetLogger that we have WJ8B. Then we have K3FCG. So, gentlemen, I have you both checked in. We have 8 check-ins so far. Are there any other stations that would like to do an early check-in? Make your call to AA4FL. This is AFL, Alfalfa 4, Foxtrot Lima. Today I'm operating out of Hawthorne, Florida, north central Florida, east of Gainesville. And we're starting the net here momentarily at the top of the hour. Before we have 8 check-ins. Anyone like to make an early check-in and they haven't gotten logged in on NetLogger already, go ahead and make your call now. Good morning or good afternoon for those of you in other time zones. This is AA4FL, Jay, operating from Hawthorne, Florida, and Alachua County, Florida today, the net control, the Medical Image Radio Council, Marco Digital Voice Net, TVNet. Appreciate the Quadnet Array allowing us to use their technology. There's many of our members here love to do digital communications, but we have different ways of doing so. So we appreciate the transcoding and the ability to overcome that limitation of having different digital systems. And we start the net here today, a few orders of housekeeping. Since the Quadnet array is a connection of servers, repeaters all over the world, make sure to pause after the previous person transmits before you transmit, and after you transmit. After you start transmitting, pause shortly before you start speaking, so all the technology can synchronize and be effective to ensure that your transmissions are being heard. Let me drop one. We meet every Saturday at 1500 UTC. That being said, we are fortunate to have Christmas being next Saturday, and the following weekend for New Year's, we'll also take a break from the net for those 2 days. So we won't be coming on until the second Saturday in January. We hope everybody has happy holiday seasons, and those who already had Hanukkah and have Christmas, Kwanzaa, and any other holiday that they participate in. Upcoming, happy holidays and a happy New Year. New Year be better. I know we have our challenges that we're going to be talking about today that will be there in the new year. But fortunately, we're here as a community, hands to help support each other and address the details of that challenge. I'm going to let it drop one. At this time, are there any stations that have emergency traffic for the net? If so, go ahead and make your call. No emergency traffic heard. Are there stations that would like to check in but are on limited time only or mobile? Go ahead.
Kilo 4 Delta Juliet Lima Mobile, Montgomery, Alabama.
QSO, Kilo 4 Delta Juliet Lima Mobile, thank you for checking in. Glad to have you here with us today. Would you like to participate in the exchange on the net? Will you be radioactive during the entire net? Over.
I will not be. I'm almost where I need to be. Pick up some food, some fruit baskets, give out to the needy. So I'm gonna be out of the vehicle, but I did want to get in for the numbers. First time around to this net. K4DJ, thank you for the invitation.
Well, thank you, and thank you for what you're doing for your community. That's the beautiful aspect of amateur radio. Many of us not only volunteer within our hobby, but we volunteer in the community in general, supporting our fellow citizens, not only in emergency communication, and in our case, medical support group for information purposes, but in every other way within our community. Thank you again. Have a very nice day, and once again, thanks for sharing your time and efforts with your fellow citizens, and have a Merry Christmas yourself and Happy New Year. 7-3 to you, and I'll let it back to you for your final if you have any additional comments.
Nothing further. Everybody have a Merry Christmas and be careful, be safe. It's rainy and I heard thunder here in Montgomery, Alabama. So, and please keep those folks in mind who have, especially those last week that went through everything they went through, and just keep them in your thoughts and prayers. K4DJ on Mobile Clip.
Well, thank you once again. I appreciate the reminder that many people here are having due to the bad weather, as well as all the other challenges that we're facing these days, and we can support them. Its significance is important, and for those of us that are fortunate, sharing life and being supportive is extremely important to the sense of community and country. Thank you very much. 7-3. Have a great day. Hope you can monitor for a while and check in Saturday morning. Any other stations that are mobile or short-term that can't be involved during the entire night in the roundtable discussions, make your call now.
Victor Echo 7 Bravo Sierra Papa.
Victor Echo 7 Bravo Sierra Papa. Richard, it's good to hear your voice again. Thank you for checking in with us today. We look forward to having you as part of the discussion. You're always a very helpful presence and a good friend, and we do appreciate you participating in that. Any other stations that are going to be limited time, and then Richard, I'll give you a chance to make a presentation if you're on limited time. Over. Okay, before we go to Richard, are there, for regular check-ins or check-ins in general, I have AA4FL, N9OML, WW9F, PY2BBQ, N5RTF, KD28ZG, K3FZT, WJ8B, K4DJL, and VE7VSP. Are there any other stations monitoring that were not on the list here? And I know those of you that are part-time and those that are not. But we'd like you to check in, and we hope you'll participate in the round table discussion. So for regular check-ins, make your call now to Net Control AA4FL.
This is
Okay, Mark WA1EXA, I got the this is, and then you dropped. So go ahead and transmit again. Let's make sure that we're receiving you properly. Go ahead.
okay. 1, 2, 3, 4, 5. WA1EXA. Are we copying me now?
QSL, perfect copy. Mark, thank you for clarifying that. Any other regular stations for regular check-ins? Go ahead and make your call at this time for the Medical Amateur Radio Council Digital Voice Net.
PY2BBQ. Good morning, everybody.
PY2BBQ, good morning, Hilton, and thank you for looking forward to hearing a report from you today. I'm sure that you have some of the same presence of issues that are going on in Brazil that are here in the United States, and the same for Richard and Janet. Are there any other check-ins, regular check-ins? And if you're monitoring and you weren't planning on participating, still check in so we know you're there. And you don't have to be a Medical Amateur Radio Council member to participate. If you're interested in healthcare, your own health, it's all pertinent here, and we appreciate you being present. So, regular check-ins, make your call to AA4FL.
Kilo Oscar 4 Bravo Whiskey November.
QSL, Kilo Oscar 4 Bravo Whiskey November. Thank you for joining us here today. We appreciate having you on board. Are there any other additional stations that would like to check in when we start our roundtable discussion? If so, make your call at this time. Okay, no other stations heard. This is Jay, AA4FL, Alpha 4 Foxtrot Lima, in north central Florida, in Hawthorne. And we've had an interesting week here, and lots to discuss. I've been extremely overwhelmed with moving family here. I haven't really come up for air. Hopefully will next week. I appreciate those of you in Marco that have sent in your renewal. Ones are due this year. If you're due in the future, it doesn't, not getting billed. But many of you sent in referral notices, applications, some online, some by mail. And we appreciate that. It's something that takes quite a bit of time for the secretary to process. But it's certainly been an interesting week in the weather and on the COVID front. Let me let it drop one. And as I said, I've been very overwhelmed, so I haven't really kept up with the news. And I know about the weather that went on across a good part of the country, certainly down around Kentucky, Tennessee, Illinois, etc. So if you have reports of what you know of the emergency efforts in regard to any aspect related to healthcare, what the impact it's going to have on Omicron, possible flare, as individuals are going to have to be host communally. Let's talk about that. Of course, Omicron as a subject comes to itself, but if there are any other subjects other than those two, certainly don't hesitate in starting a thread, and we'll pick up on the thread as we move on down the list. First on the list here, I have Howard in the Chicago land, northwest of Chicago. Go ahead, Howard.
Good morning, Jay, and everybody on the nest. This is Howard at 9OML. I didn't track any specific numbers this week. Probably had a knee replacement surgery Wednesday, so I've been more focused on getting things ready for that. I did pass along a news story to Jay that made reference to the really kind of dire numbers they're seeing in some places regarding COVID. The biggest numbers, of course, causing morbidity were the Delta strain. They were also starting to see increases in Omicron cases, and there was also reference to a study out of, I believe it was Penn State. I might have that wrong, but I believe that was the institution, indicating there's unfortunately a mismatch at the moment between what the influenza vaccine vaccinated for and the flu activity that's being reported. And it spoke a little bit to the problems of the confluence of all three of those occurring at once. And the strain they put potentially on any one person's respiratory system and collectively on the hospital system. Have I?
Okay, Howard, I had you drop here well into the discussion, though. I'm not sure if others are on my end. I'm on the slow internet here in Hawthorne. So, Andy, WJAD, if you maybe would send me a text message and let me know if Howard dropped for you too as well. That would be helpful information as I negotiate for that. Howard, you're copying again. I think you were just starting to talk about Omicron. Go ahead. Okay. Yeah, I see you. Thank you, Andy, for the message. Jack, I see that you're here with us. Katie, 4IZ, I have you checked in. We'll wait till we'll come to Howard on his next go around, and see if he is aware that he's not, he's dropping here. WW9F, Jeff, how about turning the mic here? Go ahead.
Well, good morning to you, Jay, and everyone on the net. Also in the Chicago metro area. So I think I can take off from where Howard left off. What we're seeing in Illinois is hospital bed utilization rising and U bed utilization rising. And that is as we head further into what we are seeing as a potential trifecta of Delta, Omicron, and the flu. Week one. In terms of storm damage in Illinois, the major damage was located in the St. Louis, Missouri area, just outside of St. Louis, Missouri, Edwardsville, Illinois, where there was a large Amazon warehouse center, and a portion of one of the structures was just leveled by the storm. That caused a number of deaths. There's an OSHA investigation underway to determine what happened, if anything could have been better to prevent the deaths in that facility. Other than that, we are hoping for the best here in Illinois as we see our state following national trends, at least in the Northeast and Midwest. That's it for my report. Back to net, WW9F.
Okay, thank you. I got the end of that, Jeff. For some reason, I might be having technical problems on my end, and some of that dropped out for me, and it's her DV is acting in a strange way. I might want to. I hopefully we have comments here on that logger whether everybody copies you. I am for the major, and thank you very much for being here and making a presentation. PY2BBQ, how are you doing, Hilton? And maybe you can comment on the previous two transmissions.
Okay, good morning, everybody. This is Papa Yankee 2, Bravo Bravo Quebec, Hilton from São Paulo, Brazil. And nice to meet you again this Saturday morning. Very beautiful day here in São Paulo, about, I would say, like over the 80s Fahrenheit. And it's a little bit overcast, but it's mostly sunny day here. Beautiful Saturday. And regarding COVID-19 here in Brazil, what we see is that the Omicron variant is already in the community. We have seen people infected with the Omicron that didn't have any contact with people that came from abroad. So it's already in the community. And but we didn't see an increase either in the number of new cases, neither in the number of new cases nor in the number of deaths. What we see here is a continuous drop on the number of new cases and the number of severe cases, hospital stay, and deaths. Wait one. Yeah, back to, yes, I always try to check out if I'm transmitting, and that seems to be all right. So, with the average number of deaths, daily deaths here in Brazil is from 100 to 150, which is the lowest number since the beginning of the pandemic. What we have seen here these last days and last weeks was an increase of the number of people with flu-like symptoms related to influenza. We are seeing an influenza epidemic here in Brazil at this time. We hope that as soon as the summertime approaches, it will decline as well. So that's the picture here in Brazil. And regarding ham radio activity, we are having the Canadian contest. I did a few QSOs yesterday night in CW. It seems that the propagation is better this weekend than it was the last week. So back to you, Jay, for FL PY2 BBQ.
Thank you for the report, Felton. I had a friend send me the solar flux and spots, and I think we're seeing stuff up in the 120 range. So apparently, the activity is getting more active. Hopefully, that's a trend that continues, especially with Beauvais hopefully going online here soon. So, Felton, thank you for the information about the influenza. That's a big concern here, as Howard reported, with the vaccine not being necessarily a good match for the strain of flu that's circulating this year that could really hit the population heavy if we're going through Omicron infection at the same time. As far as a follow-up question before you're here, Hilton, because here in the States, with our overall vaccination rates, we're not seeing a decline in most areas, we're seeing an increase. But do you feel that Brazil is seeing a decline because of vaccination rates and booster rates? And what kind of status are we on that there? PY2 BBQ AA4FL.
Okay, for FL and the group PY2 BBQ returning, yes, I am absolutely sure that the reason of this decline was the success of the vaccination program here in Brazil. We had a real nightmare a few months ago, and being the first in the world in the daily number of deaths, and what did the difference for sure was the vaccination program. We had an average of 2 million people being vaccinated every day in the country. And even though most of them used the Chinese vaccine, it was certainly effective in regard of decreasing the severity of the COVID-19 infection. And even though with new variants, we don't see severe cases as we saw a few months ago. So yes, today here in São Paulo, more than 90% of the target population of the vaccination program had already received at least 2 doses, and at 10 or 15% of the whole country population have already received the third shot, and those were the most risky people for severe case. So yes, I'm sure that the success of the vaccination program here made all the difference. So back to you, A4FL, PY2 BBQ.
Thank you for the description, Hilton. Hilton, I just have a comment or question, and the center around children. I assume they're not being vaccinated, at least the 2 to 5-year-olds, and I'm not sure the ones 5-year-olds, 12-year-olds in Brazil. But assuming we have an Omicron that's able to infect unvaccinated populations and also cause breakthroughs in those that have had vaccinations, I'm not sure the percentages. You hear numbers being floated. I'm sure the research is still being done. But I mean, boosted individuals certainly have a good chance of protection, but there's still a significant breakthrough, just hospitalizations. And the University of Florida yesterday circulated an email to the president's office that cloth masks were not to be used anymore, strictly N95, because the cloth masks do not fit well enough, and Omicron is so infective that colleges here in the United States are experiencing huge amounts of infections in their population. So, knowing these facts, do you expect that Brazil may turn around and have increasing numbers in the near future? Over.
Okay, back Papa Yankee 2, Bravo, Bravo, Quebec to Marco DV Group. What we experienced here is that we kept the children at home studying and by their computers longer than other parts of the world. That was very much criticized here because children were away from school, and not everybody could have a good quality of studying at home. Not everybody had access to good equipment and high-speed internet for in order to have appropriate classes and opportunity of studying. But anyway, it prevented. I think it also prevented a lot of dissemination of COVID-19 among children and adolescents. And the vaccination now here is starting at the age of 14 years old, adolescent from 3.
Okay, thank you for the comments from those of you. Let me know that Milton is having periods of dropout. I'm experiencing the same thing here. So I did catch the part that he said vaccinations started with 14 there. So as we've spoken about in this depth, time will tell all and what the actual experiences are going to be. I mean, we can understand the risks, but in trying to estimate the infectivity and the way that it will spread the population, we can only express concerns and do what we can preventatively. So, assuming that there is going to be a flare here due to Omicron, and since we've had so much wear and tear in society, which, by the way, is a little different than in Brazil, which everything goes through the their separate health administration. All the decisions, they don't have the political intrusion that we do here. But for CHIP N5R2F TF, that's next on the list. I know you said there's a delay in psychiatric problems from in expressing from these challenges. There was another wave upon us, potential wave. Do you have any intuition on how much the public can take without having breakdowns and depression? Over.
I think you lost part of my transmission. Well, what we see here in Brazil, Jay, is that we have a culture of vaccination very well established in the whole population. So quite a few people is denying to be vaccinated here. Although we also have those political problems with people being against the vaccination, most of the population will not question the necessity of the vaccination, and we'll follow what the science and the control agencies, health agencies will demand. So it's not being such a great problem here in Brazil than we see in other parts of the world where people, many people is really against the vaccination. So I don't think it's going to be a problem here in Brazil, Jay. A for FL PY2 BBQ.
PY2BBQ AA4FL, thank you for the follow-up explanation built in. And as we go over to CHIP N5RTF, I want to comment on the overall discussion here, but particularly in the past when we've asked CHIP whether or not psychiatric or mental health issues were going to arise out of these challenges, and now being a potential flare again, how much can we take and how do we prevent it and how do we support the public as micro members, emotionally, certainly our own members. I just had a cousin that is very protective, been infected, been vaccinated, been boosted in Miami, and just picked up, I assume it's Omicron, yesterday. So it's going around Miami right now, in the Miami area as we speak. Must have got it from work. He's been nowhere else. So CHIP N5RTF, AA4FL, net control. Turning it over to you.
Okay, good morning, Jay and the net. I'm sitting here staring at the water. It's 71 degrees, just had a light rain, calm wind. It's supposed to be a very wet day today here in Louisiana Swamp. Our football coach, Sean Payton, just got COVID again. He had it before. He was fully vaccinated, and now he's got it again, just like you say, probably Omicron. From a psychiatric standpoint, there are people who are depressed and anxious, not being able to socialize fully, but more people are getting out now, and it's sort of leveling off. People, on the other hand, people with agoraphobia think this is the best thing that's ever happened to them. Nobody's hoping to get out. And finally, suicide rates are actually down. You might think it'd be the opposite, but they're actually down in 5RTF.
Well, that's an interesting observation, so thank you for expressing that. I wonder what the factor for that is, if that's overall. Any thought on the healthcare community who's under particular stress right now as these hospitals start to fill up again, even though we may not be as infective, the sheer number and quick spread of the infectivity, even a large number of infected with a smaller number that end up in the hospital still end up in trends. So any idea for you of the healthcare community, how much stress they are under from a mental health perspective? And 5RTF, correct?
Our consult team gets a lot of calls. But one thing to keep it into perspective, no hospital has a lot of excess capacity. You have to get a certificate of need from some government agency to even add beds to a hospital. Plus the suits that run everything, they want to stay at about 95% occupancy all the time just for economic reasons. So there never were a whole, wards, empty ICU beds that got filled up by COVID patients. The COVID pandemic was right on top of all the usual stuff. So it didn't take a whole lot to fill up hospitals because they were already running at 90, 95 just based on the way that they're designed in 5RTF.
Well, thank you for the input, Jeff. We'll just have to see the reports that are in the public media as to how many nurses and affiliated health providers outside of the physicians uh, actually quit the profession due to stress. It seemed that that had already been a factor in assuming that they feel that the unvaccinated pool of people that get infected were preventable and they're discouraged by that or depressed by that. That's a significant potential factor. But again, with Omicron, that may not even be a pertinent, totally pertinent issue. And obviously, the unvaccinated would be a source of infectivity. But beyond that, so would everybody else. Less likely to end up in the hospital. Thank you for your input, Chip. KD2-8ZG, would you like to participate in the conversation? Go ahead.
Yeah, this is KD2-8ZG. I guess I have a question for PY5BBQ. I was just wondering if you're seeing any similar trends with resistance to the vaccine, or not resistance, but less enthusiasm to get the vaccine among healthcare workers as we are up here in the U.S. When our physician vaccination rates are incredibly high, the ancillary healthcare positions seem to be significantly so, dwindling around the 70 to 50% mark, depending on the profession.
Oh, I'm sorry. I'm sorry. I was not close to the computer right now. Would you please repeat your question over?
Yeah. My question for you, just down in Brazil, are you seeing similar hesitancy among healthcare workers to get the vaccine, specifically within like the nursing and the pre-hospital setting, maybe even other ancillary positions within the hospital setting, like respiratory therapists and positions like that?
PY2 BBQ returning. Well, as I could understand, was something related to pre-hospital nurse personnel and respiratory physiotherapists people, but I didn't really understand some problem. I have some problem with my audio here. I didn't understand the point of the question regarding this healthcare personnel, but related to the vaccination, they are all vaccination, that they were the first to be vaccinated and to receive the third shot as well. And there is no conflict regarding vaccination of these people. And although they were more exposed to COVID-19 in the beginning of the pandemic, many healthcare professionals, doctors, nurses, and physiotherapists, dentists, and so suffered more than the average population with COVID-19. We don't see this trend right now. Was that the point over PY2 BBQ?
Yes, that was basically the question. Up here in the U.S., we've seen, like the nursing unions and the firefighter unions and some of the respiratory therapist groups actually resistant to mandatory vaccination of their professions. And I was just wondering if that was a trend you'd seen done as well, but it appears that the nurses down there got the vaccine early on and are already getting a booster. I think up here they're actually having a problem where they're starting to have to terminate employment with large groups of nurses because they're refusing to get the vaccine. I don't know if that's a local issue to certain areas up here, or if that's more widespread across the U.S., but firefighters are kind of going through the same thing as well, where upwards of 60% of firefighters don't want to get the vaccination, and the union is having to sort of supporting their employees and enforcing the vaccination mandates.
Oh, now I got it. That's a very interesting point. Very interesting point. You see, at least here, most of the unions are politically left-winded. So, and the government right now in Brazil, it's of the right side. So, they are always in opposition. So what we see here is exactly the opposite picture. All the unions are working for the vaccination and not against the obligatory vaccination, but they are in campaign of obliging people to be vaccinated. What the central government is absolutely against any obligation of vaccination. The central government is it would be like what the Republicans act in United States. They prioritize the individual choices and the liberties. So they would never oblige people to be vaccinated. But the unions here have exactly the opposite view. So I see that, and in that regard here, it was good because most of the workers in every profession are already vaccinated. No opposition from the unions for that. Back to net control, A4FL, PY2 BBQ.
Okay, thank you for returning it to net control, Joseph. This is AA4FL, net control from the Medical Amateur Radio Council. That was a very important exchange, and thank you for answering the questions. You got it exactly in response. Dilemmas here, there are differences from country to country. But again, Omicron may upset the apple cart here into reality, no matter what the vaccination status is in terms of causing stress. Maybe not as much mortality, but we'll just have to see about morbidity. The judgment's out. Ongoing situation. We talk every week, and it seems like the 7 days in between our Saturday discussions, so much more is out for the count in the public venue for the most part. So everyone seems privy to the information if they read some sort of unbiased news source, one that sticks close to the statistics and not motivated in other ways. AA4FL net control for the Marco Digital Voice Net. Before we continue, are there any other stations that would like to check in at this time that have not done so already? Go ahead and make your call. Okay, none being heard. KD2AGG. Do you have any other follow-up comments or questions before we move down the list to the next check-in? Go ahead.
Nope, that was it. I appreciate the net being here. It's a pretty good opportunity to connect to other, medical people in various parts of the world. I think this is a great opportunity. So thank you to the net controllers and for everyone who participates. And I'll be clear and monitoring.
Well, thank you for being here with us today. By the way, NetLogger, the program NetLogger, we have an instant message window open, and individuals are putting in messages there, including one from Hilton who was streaming the audio on YouTube, audio and video actually. So if you would like to share the recordings with other people, other friends, other health professionals, you can get those on YouTube. The link is here, but you can also get some of that information from the listserv from the Medical Image Radio Council. So those are your members that get circulated on the listserv, and you can just Google YouTube Medical Image Radio Council. You might have to use Marco, you might have to use the full name DVNet, digital like that. But you'll get a list of all the recordings. Let it drop one. And we also have fine audio recordings provided every week. I know other than Chef M5RTF who's here with us today. So I believe that's marcoaudio.net. And you'll have access to those immediately and archived ones as well for our regular grand rounds on the net, our medical discussions, as well as the COVID net. Many of the COVID nets are held separately out in the middle of the week on 40 meters. So we hope you'll be able to participate in that. Thanks for being here with us. Next on the list, K3SGT, Stephen. Good morning, Stephen. Go ahead.
Good morning, Jay. Good morning to all.
Okay, this is AA4FL. I sent Steve a message. I wasn't hearing his audio. So I'm not sure if I'm the only one or he's dropped out. I see a message from Andy. He couldn't hear him either. So we're having a few issues here on the technical side today. Until Stephen comes back, Andy, why don't you go ahead to the JAD and pick up the microphone? Go ahead.
Well, good morning, everybody. That's a lot of interesting topics. Lots of them, in fact. On the other front, so many interesting news. Somebody predicted that Omicron was, going to be the beat out Delta, because it's more effective. The only the aspect of that is, could there be a benefit of that? It actually affects more people as long as they don't get really serious disease that may impart some immunity to those who aren't vaccinated. So, kind of a strange way of looking at it, but I threw that out there. One thing that Chip brought up was about the hospitals always operating at 95% capacity, and they're designed that way. And that's really not just hospital systems. That's a lot of businesses and around the country that operate that way, including our shipping and supply chains and so forth. So you have a wrinkle in the thing that disrupts that. All of a sudden you have crisis. That wasn't the case when most of us were in training and probably the first half of our career or older. So it creates problems everywhere when that occurs. And so something like COVID, the crisis like we're experiencing here in Ohio with our healthcare system, is particularly bad. Here's what Delta, and some people who are unvaccinated, and many of them are seriously ill. My daughter's now growing up. We got 5 days around Christmas. We're going to have all the sun here. there's only about 18 hours in that 5 days that we're guaranteed that he'll be able to visit at the same time that he's here. So that's purely because of the outbreak in the hospital system that we break. Tip one up the psychiatric issues. Just have a couple of signs there. Of course, my daughter's stressed for that because he has to work so much. He's doing relatively well. I have two granddaughters. One is 14, one is 16, he's soon to be 7. During the time schooling at home, it can't go up into that short period of time. So it works all different ways. So good to hear everybody on the net this morning. I'll give it back to you. Okay, from WJAD. Yeah, I'm not an economist. I do read the stock market stuff and I read research on it just because I want to keep track of what my financial advisor is doing with my money. And like you said, it's true. I mean, it used to be we could put conservative money in a bank and earn a small return. And people would do that with their money, but for the last several years, you can't really do that. I mean, sometimes they even charge you for keeping your money. The only way to have any recovery is to be invested in the market in one form or another. It can be conservative bonds or conservative annuities, etc., or it can be in the equity. And of course, we do portions of all the above. But why they get so high is hard to say. The thing I think I have the most concern is that a lot of the profits that have been made in the last 10, 15 years have been making everything as streamlined and as efficient as possible. And that goes back to the narrow margin thing. And, that probably has fueled a lot of the earnings that we've had. And I don't know if we're going to be able to continue that in all those industries, especially given what's happened with the virus. And a lot of people have quit their jobs. It's primarily due to that, and it's kind of the same in healthcare. There's only so much work you can do. I have a personal life to maintain, different things at different ages. So that's the part that has me concerned about the long-term things with the stock market. It's often based on those efficiencies, and those efficiencies have gotten us into trouble. So back to you, Jay, from WJP.
Thank you. And the Dennis, we tend to be conservative bunch, but I'm sure plenty of us trust our financial advisors. But to me, the logic of having no guaranteed return or almost no guaranteed return in contrast to a potential disaster of a 10, 20, 30% loss, that becomes a 30% gain if there's a 30% loss in the market. So I don't see not having a return as necessarily as impactful on my personal end, but maybe I'm an unusual person in the way that I process the world, and maybe we've gotten to the point where we feel the stock market is too much of a guaranteed outcome on the positive side. Let's hope the system is not stressed, but the question becomes real money and real data and who's making the money, where's it going, how quickly is it being drawn out. Are we transferring funds from people that can't afford to do so? So that's a better knowledge of and have less risk because of that knowledge. It's a very complicated system. I'm not an economist either, so none of us are, but it's certainly fair game for conversation on the net here. So I'm going to go back to Steve because I believe he's got his equipment worked out. Steve, keep it short here. K3FCT. So we're sure we've got it worked out. Go ahead.
AA4FL and the net. This is K3FZT. Quickly, infection rates by PCR have doubled in a 3-day period in New York City. That's never been seen before in the course of the pandemic. In Philadelphia, we're seeing 45 to 50% 2-week increases in cases and deaths now. Am I being heard?
I'm having you drop out a little bit, Steve, but at least I'm able to get the gist of the conversation. It's very small drop-ups, but if I could be on my side, go ahead.
Okay. Beyond that, I don't have much to add except to say to everyone that at least at the moment, my wife and I plan on travel to Hawaii for snowbird reasons. And for the next 2 Saturdays, family commitments will override any participation should the net be held. From Hawaii, 5 hours behind, it'll be too early for me to get on the net. Wish you all well this holiday season and for the new year. See you in late March. 73, everyone. K3FZT. One and done.
Stephen, 100% copy. I hope it works out well or helps and the Omicron doesn't interfere with your travel plans and enjoy your time in Hawaii. We're not going to hold the net next Saturday. So we decided not to announce that at the beginning, but I'll make sure to repeat that on Lester. It won't pick up till the second Saturday in January for everyone that's wondering. Thank you for participating. Be safe. VE7, BSP, Rich, I hope you're still here with us. Go ahead.
Hey, FL, this is VE7 BSP, and good morning to all on net. We've been a little bit busy here in Canada around COVID because just in the last couple of weeks, we've seen major uptakes in positive test cases. And here in British Columbia, just yesterday, we were at 789 new cases, and total active about 4,300. 2 weeks ago, we were down in the 300-400 new cases per day, so this is quite quickly for us. And it was forecasted in the projection models that this past week, the Omicron variant would become the predominant variant, superseding the Delta variant. Wait, what? Over the last little while here in British Columbia, we've had some COVID hotspots in the northern interior of the Okanagan Valley of British Columbia, and also in northern BC, where vaccination rates are a little bit lower, and many of the infected people were of Indigenous heritage.
there's a number of factors as to why that might be the case, that their vaccination rates are lower. But what it ended up doing is all the hospitals on the island, as well as on the lower mainland, where the larger population densities are, their ICUs became filled up, not just with their inpatients, but with patients coming in from the Okanagan and from the northern part of the province, just to make certain that we could care for those COVID positive patients. Rewind. In terms of other fun that we've been having in British Columbia, you should probably heard out of Washington State as well. There was some weather rivers coming in off of the open Pacific a couple of weeks back, and lower mainland British Columbia, including here on the island, major highways and major low-lying areas were flooded, and highway passage was blocked, and highways through the BC interior, getting from Vancouver into the Okanagan. Multiple bridges were taken out because of meltwater and the rain volume coming down. So we're still recovering from that, but the roads are open again, but not slow traffic moving across. Goods are still getting through again, which is nice, and but there's a lot of repair work yet to be done. And then the final piece is, so far, influenza, in spite of the forecasts for its virility this year, we're all getting quadrivalent vaccines, but so far we're not seeing any hospitalized cases of flu. What we are seeing, however, is a number of people coming down with RSV, Romeo Sierra Victor infections, and that's taking them out of action for a few days. That's my update, and back to you, Jay. E4FL, this is E7BSP.
Thank you for being here to make that report. We appreciate that, Richard, and the perspective of the indigenous people from the northern part of the province is something that's important to hear. There are, I'm sure, areas that have lower rates for many reasons, including cultural reasons, and we have to focus on making sure they're educated as well and given the opportunity to trust the science. Let's just hope that this crisis is not flaring up. And we were always concerned about the escape mutants, the one that escaped immunity. So apparently we don't have a strain yet that does that. But Omicron is testing it. It's certainly it's not getting the full protection that the Delta earlier strains have gotten from the vaccines. So we'll see in the long term. Okay, KD2AZG, thank you for your comment. I'm the one to direct AA4FL about joining Marco, but go ahead and send me an email and then give him QRZ, and I'll handle that situation directly for you. So it's nice to know we have the NetLogger has instant message features. Chatting goes beyond the usual net flow here and gives us an opportunity to address issues and concerns other than just having a roundtable discussion. Richard, thank you for being involved in the roundtable. WA1EXA, Mark, go ahead.
WA1EXA is here. I really don't have anything different to say. It's pretty much about the same here up in the Northeast. The weather is definitely turning colder. We've had a little bit of snow up here, but not on the Cape. But on the mainland they have. I'm fighting a toothache. That's about the only thing I guess I got to report. I'm kind of getting ready for the holidays, so we have all the same problems that everybody else is having. And we're just seeing the same thing as far as ICU and the actual rates going up. So not much too much to say. We will wish everybody a good, happy holidays, and try to stay safe, everybody, and warm. WANEXA.
You as well, Mark, and I hope you feel better and have your rebel challenge successfully taken care of quickly. But have a wonderful Christmas. Hard to believe that here next Saturday we're already at Christmas, and I guess there's so much more that goes on this time of the year, family time. And we're talking about Omicron. I hate to be negative, but we'll have to see what happens from that. People are going to get together, and it might hasten the spread. Terrible timing for this challenge, but we're all exhausted from having our family gathered and it's affected. And I'm sure many people will not even consider it. So hopefully it won't turn out to be a negative. Let's pray for some divine providence now here. KO4BWN. Go ahead.
Good morning, all. It's KO4BWN. My name is Ed Echo Delta. I'm in the Atlanta metro area. This is my first time listening in on the net, and I'm greatly enjoying it. Things on my mind from the past week or so was an earlier topic in the net, and that's of the storms that hit, the Missouri, Tennessee, Kentucky, Arkansas, and so on. I have personal vacation interests in the very northwest corner of Tennessee. It's a lake there called Reelfoot Lake, and the two counties that surround it accounted for 4 of the 5 deaths that occurred in Tennessee. The fifth one was in the Memphis area, but anyway, I go up there and I fish every year, and those storms wiped out. These are very small communities. People don't have very much, and those storms wiped out several businesses that are vital to the tourism industry that goes there, and it's just I wasn't able to reach any of the nets that amateur radio was having, any Aries nets that might have been going on because I'm too far away, but I did listen to the police and fire feeds on the Broadcastify website, and I'll tell you what, while these to get to the different areas where storm after storm was hitting, it was impressive. And I tell you, I'm not a first responder, but listening to the way that these people were handling the traffic, the 911 operators that were dispatching, it was really impressive to because they don't have a lot of help in that area, and they just did a phenomenal job. So anyway, don't know if any of y'all are first responders, but if you are, I have mad respect for you. It's KO4BWN, back from the control.
Ed, thank you for being here with us today. It's been on a lot of our minds, but your perspective of having familiarity with one of the areas that was greatly affected. We appreciate you expressing that and reminding us of the importance for all of us to help support those areas in any way we can. I don't really know about the emergency communication nets and if there are any that we're capable of being heard locally for you, but wouldn't it be nice if the Quad Net Array or group used this one so we had other ways to access them no matter what digital mode those individuals are using via GovChat. So hopefully somebody can take that and make that suggestion to the existing nets so they might consider one that's transcoded. It would be of great value. Can we let it drop one? Yeah, I read, having read the one story recently, showed a path of a tornado where a photograph traveled. I don't remember it was 120 or 220 miles. A wedding photo was found downrange. That's testament to the incredible damaging situation that was present. To have something that's so powerful be on the ground for so long. Thank you for all of those that are first responders. Chime in here with what Ed has said sincerely. And those of you that volunteer in capacities in amateur radio. We're very grateful to you all for taking the time and encourage you to continue. Next on the list, KD4IZ, Jack. Jack, please. Go ahead. Yeah, good morning, Jay. Good morning, all. Been largely absent because I've had a series of meetings and other activities Saturday mornings that are directly on top of this. With the time shift, it kind of whacked me. This morning is one of those mornings without. So, well, you guys have been all over the map here. I can tell you, based on what I heard from Steve, we're having a very similar situation here in Maryland. COVID-wise, I know that in the red counties, the hospitals are already doubling ED beds and doing other things. So the issue is here. Our friends at the NMA convention in New York, where a lot of us seems to have turned into a super spreader event around the country, particularly the college campuses. I just it boggles my mind, but that's apparently one of the ports of entry that got it going. The rapidity of spread is good. Only comment I have there. We were talking about the trifecta earlier. There's more to that trifecta than most people think about pediatrics wise. RSV is a big issue. It tends to be a uncomfortable sniffle and upper respiratory yucky thing for adults, but I think the pediatric population is particularly bad, particularly the younger ones. Anyway, it's a number, that Susie is working with. There's continuing to see more and more of the MISC patients, post-COVID, many of whom have to be evacuated to critical care centers. It's really a mess there. So from the pediatric point of view, okay, hopefully I'm back. I know that we've had some problems, particularly with BlueDV, but some problems with dropouts here. I know they've worked on it, have improved it. I just don't know how it's going. Anyway, the issue of truly naive individuals is large here in the United States. So we may not see what other countries have seen. We have a significant pool of truly immune naive individuals. One of the interesting things about Omicron is it looks like it's not deep lung tissue as much as it is bronchial tissue that are really
likes to replicate in some of the experiments that I've read, results from, seen information about, indicate that it has a different tissue tropism. And that may be a benefit, it may not. So we'll see how that works out too. Not a lot of Jay. A lot to think about, a lot to work with head-wise. Katie Forrest. Yeah, thank you, Jack. Thank you for adding to the discussion. And you're right, we've been all over the place, especially we've covered a lot of territory today in a structured manner. We do appreciate everybody's input. Right along that, already 17 minutes past the normal allotment of time, and 13 participants today, so we appreciate that. And look forward to getting together with you 3 weeks from now. And we will not have the net for the next 2 weeks. So unless there's any follow-up need of immediate nature to have additional discussion, I'll give an opportunity to express that before I call the net to a close. If there is, I'll start a list for discussion of any follow-up. But are there any additional topics that one feels we need to discuss today? I can't wait for 3 weeks. Go ahead and make your call to net control. AA4. Okay, no additional topics. It would be interesting being a 3-week hiatus. It was 1 week we've had so much information. So just the half-life of knowledge here. It was even 1 week when it came to Omicron, so we may have a little bit more concrete information 3 weeks from now. But the listener from Mount Medical Emergency Radio Council, the listener, is a venue that can be used on a daily basis. So don't forget that. Feel free to ask questions or express concerns for them. And you can sign up for that if you have any questions by QRZ email address AA4FL if you're not already on that listserv and you're a Marco member. And any membership concerns, do the same. So until then, I'm going to say 7-3, and everybody have a wonderful Merry Christmas, Happy Holidays, Happy New Year, and let next year be one of quickly reducing challenges. It's been a very tough 2021. 7-3 all. AA4FL. We'll hang around for a few minutes before calling the net to the close. And thank you to the coordinator Ray once again for the technology 7-3.
Just wanted to say Merry Christmas and a Happy New Year for everybody. I'm sure we'll have a much better New Year in 2022 than we had this previous 2 years. So best wishes for you and your family from PY2BBQ. See you in 3 weeks. Bye-bye.
Thank you very much, Shelton, and thank you to you and to Chip for recording the net and making it available. We'll make sure we distribute the information about not meeting the next 2 weeks and the links to today's net so individuals can have their interest piqued for participating next year. Maybe we can ask for a New Year's resolution of getting digitally active for our members. That would be of great benefit to them, and certainly we'd enjoy having others around. 7-3 there. Chip N5RTF, are you still around?
Hey, I am still on. I've cut off the recording now when I was fixing to upload it. Good net. I'm going to sort of miss it the next 2 weeks.
Yeah, me too. My emotional support system, really. I mean, I'm not practicing dentistry anymore.